Hi, everyone. It's so nice to meet you. I want to quickly, before we jump into this conversation we're going to have today, just introduce myself and my colleague, Nick, who's on the phone. I'll go ahead and introduce myself, then I'll kick it off to Nick. I'm Jessica Neyer. I'm the VP of Strategy here at Mend. I really joined the team. I have a background in health tech, specifically operations and launching companies that are really changing the game in terms of how they deliver care for providers, as well as further engage patients. I joined Mend towards the end of last year because they were really doing something unique, specific to the space that we're talking about, telehealth, which is really rare to see nowadays. There's a lot of companies doing the exact same thing and very few that are actually making this approachable for physicians. And Mend is the only one I've come across. So I was really eager to join the team. So I'm excited to talk to you guys today. Nick, I'll pass it to you.
Thanks, Jess. So my name is Nick Neral. I'm the Director of Business Development at Mend, and I have been here since about the middle of 2018. So it's been a good 2.5 years, and Jess hit the nail on the head with what is so special about Mend, and I'm excited to talk more about that today.
Perfect. Yeah, I'm so excited. So really quickly, kick us off before we really jump into it. I want to give you a quick overview of what we'll be talking about. So we're really going to go into the evolution of virtual care. What has happened over time? What have we seen in the industry that's led us to the situation we're in today? What are customer sentiments? And when I say customer, how are both the patient and providers feeling about telehealth? Because I think you need to consider both in the conversation, and it is so rare. Usually a company is just looking at one side or the other. They're not focusing on both. So we'll talk about that in a second. The third thing we're going to talk about is, as a physician, what are common adoption mistakes when implementing telehealth in their practice? Because truthfully, we've seen them all. And we want to make sure, whether it's with Mend or someone else, that you're avoiding it for your own practice. And telehealth is something that is instrumental and successful for you. Finally, we'll give you a new product sneak peek. We've been working really hard on this. I'm very excited. So Nick will walk you through that. And then we'll take audience Q&A. So a couple things before we get started with that. At the bottom of the screen, there's a little icon that says Q&A. Feel free as we're going, just drop questions in there. We'll be monitoring that section, and be sure to leave time at the end to answer all of your questions. I know I will forget questions unless I ask them as soon as I think of them. So be sure to use that. And then one other quick bit of housekeeping. JD was supposed to join us for the conversation, and I kidnapped him. No, really. He had a customer call that he really needed to jump on. At Mend, we bend over backwards for our customers. So we wanted to make sure to make that a priority and get them everything they're needing. So with that said, we'll jump into things. So really quickly about Mend, just to kind of set the stage so you know why we're talking about this and what we've seen over time. So we are a end-to-end patient engagement solution. So we offer everything that the practice needs to truly implement virtual care or telehealth within their practice, because it's a lot more than just a face-to-face video visit. Right? There's the appointment reminders, there's messaging, there's transfer queues, there's the payment side, there's digital intake forms. There's so much. We cover it all with our product. So we'll walk you through that, or Nick will walk you through it. All right, so let's talk. This is my bread and butter, so I'll talk probably too much about it. Please tell me to stop in the chat. But we're going to talk about the evolution of virtual care. This is something I'm really passionate about. Just to give you a quick backstory, telehealth has been inching along in terms of market share that it's had. We've been around for 5 years. We've been doing telehealth for a very long time. And telehealth was inching along, but there were certain reimbursement factors and different things that caused it not to be widely adopted by all specialties. It was really more adopted by cash paying services up until recently. When the pandemic hit, quite a few things happened. Number one, every single provider, and I'm sure you can relate to this, went into survival mode, right? Every single practice was shut down, and there was no other way to see a patient than through telehealth. So overnight, we saw the entire industry, which is shocking for anyone from healthcare, which is everyone. We're all very slow to adopt anything. So it was shocking to see overnight everyone needed telehealth very quickly. So they instantly went to something quick and cheap to adopt, and now it's not really working, which we'll get into in a second. The other thing we saw through the pandemic, it was sort of, there's a lot of negatives with the pandemic, but this was a blessing in disguise. It caused reimbursements for telehealth to completely shift, right? So now it's actually reimbursable, which opens up a whole new opportunity for providers to implement this in their practice. And what we're seeing, and we'll get into this as well, is that's not going away, right? So those reimbursements are not changing. The world has experienced telehealth and wants more of it. So those are going to continue to be there, and it really makes it something worthwhile for the practice. Where we are today is this position where the pandemic is almost over, right? It's slowing down. Practices are opening up, which is phenomenal. But we're still in a position, and we'll get into this soon, where patients have experienced telehealth, providers have experienced telehealth, staff members have experienced telehealth, and everyone's saying, you know what? I like this, especially from the patient perspective. I can tell you firsthand, I live in LA. To get to a provider's office typically takes, with traffic, like an hour each direction. I have to pay for parking. I have to wait in the waiting room for a 5-minute visit. It's awful. If I can just use telehealth, that's all I want. And that's all we're seeing in telehealth from the patient side. And the providers are realizing, oh, I can do a lot in telehealth. Pretty much the way I put it is, everything that doesn't require you to put physical hands on a patient can be done in telehealth. So all these new use cases are coming to be. And where we are today is practices are realizing, okay, this wasn't just a quick and dirty thing for me. I need a solution that actually scales with my practice and allows me to seamlessly go between the physical side of my practice and the virtual. And that's where we come in. And so we'll talk about that later. And then one last thing before I get started, the reason why this is so personal for me, I was previously at a company before this in that health tech space, not in telemedicine at all. The pandemic hit and we were like everybody else. So we weren't necessarily a practice, but all of our providers, we realized overnight, if we wanted to continue staying viable for our providers, we needed a telehealth solution. And we very, very quickly looked for anything that we could embed into our solution. And I always give our president a hard time. Mend was on the top of my list. I wanted to partner and embed because they were so reputable in the space. But we didn't. We went in another direction. And it just proves how critical this is to do the right way for the practice, because we went fast. We embedded a solution. It was awful. It didn't have what we found out we really needed in order to be viable for our practices. And we ended up abandoning it. And the same is kind of true for practices as well. That's the exact story and exact same scenario we're finding ourselves in. So really, really can speak passionately to that, but we'll continue on so I don't talk for 6 hours about this. I could. All right, so let's quickly talk about the client or the patient sentiment. I get this all the time, specifically not from providers. Providers are getting this more and more, but a lot of outside people look at telehealth and they say, oh yeah, telehealth, you just needed it during the pandemic, but now practices are open again and we're fine. We're going back to that. That's not the reality of the situation. And let's look at real data. I mentioned this before, both patients and providers have had a taste of this and they want more. So data coming out of HIMSS, this focuses mainly on the patient side, right? So what are your patients saying? What do they want? I found this really, really interesting. Just to highlight a couple different statistics. This is based off of data from HIMSS, so it is reputable. 77% of patients are willing to use some form of telehealth post-COVID, right? That's really, really important. So it's not just a COVID thing, which I hear all the time. This is data saying exactly patients are open to this, but more importantly, 41% of patients surveyed said they prefer. So not that just are willing to, they actually prefer to use telehealth in specific circumstances post-COVID. It's exactly the scenario I just explained to you. For myself, instead of driving an hour, paying for parking, waiting in the lobby, all for a 5-minute visit, it is so much easier when I don't have to take time off of work. I have a 2-year-old who's nuts in the background. I just want to be able to see my provider in the comfort of my own home and be done with it. So this opens up a huge new opportunity and more patients. When you're thinking about this from the provider's perspective, you can actually see more patients because they're actually willing to come see you versus putting it off weeks and months and whatever else. I can't tell you the last time I went to the dentist, which is embarrassing, but for that exact reason. The last part of this I'll really point to is the reimbursement side. So we find the sweet spot, and data is actually showing this. Patients are willing to pay for telehealth is about $80 per visit. Now that's based off of cash prices, right? So that opens up a whole new opportunity as well, that you can be either using insurance or not, and what patients are willing to spend for it. Perfect. All right, let's talk about the adoption mistakes. So not necessarily harping on it, but this is what I see most often. Again, providers chose a telehealth solution really fast. And what we found they're mostly using to date is the same solution as like the plumber down the street. Or you'll see here, Zoom is often used. I used Zoom this morning for my workout class. It's exactly the same, right? You just slap HIPAA compliant on it. It doesn't actually integrate with the practice's workflow, which leads to more challenges than you would think, and we'll go into it. Same is true. A lot of providers are still using either just FaceTime or a very, very simple telehealth solution, which does not allow them to go seamlessly between their physical and virtual practice. All right, again, on those same lines, data is showing of those, telehealth solutions, a majority actually don't work with the provider's EHR. Let's be real, everything happens in the EHR. Whatever your role is at the practice, that is your holy grail, right? At the end of the day. And you want to make sure you're using systems that integrate with that, so your life is easier. You don't have to duplicate efforts or anything else. And there's so many challenges that go along with it. So it's critical you find something that actually works with your EHR. All right, high level overview. What are the most common pain points or adoption mistakes for practices? Number one, like I just said, no EHR integration causes a huge amount of frustration, duplicate entries, I'll give you a scenario, multiple appointment reminders going to the patient, some from the EHR, some from the telehealth solution. The patient has no idea what to turn to. It leads to all these issues. It's a lot worse than you think it is. The next big issue is providers tend not to think long-term, right? They just want cheap and they want now, but they don't actually realize, wait, what is that costing me in the long run? How many hours do my staff have to put into this as a result? What am I paying? How do I equate that? And so it's really important it's taken into consideration. Like I mentioned before, sorry, I didn't actually mention this before, but sort of along the same lines, when a lot of providers, and I'm going to take a sip of water, I don't know what I was choking on there. A lot of providers, when they're using a simple telehealth solution like Zoom or FaceTime or anything else, it requires them to use a lot of other point solutions. So maybe they need another solution for intake forms, another for appointment reminders. That gets really, really expensive, really fast. It's really time consuming. It doesn't speak to each other. It's awful. And there are a number of other issues. So, a lot of times you have to figure out reimbursement. A lot of providers haven't figured it out yet. That's a big area for providers to work on with telehealth adoption. Not many actually realize, okay, with some of the solutions, maybe they require downloads, right? They require additional work from the patient perspective. And if you don't explain that up front, then it leads to the patients not being there. It causes a lot of stress at the end of the day. And like I said before, there's a lot of basic solutions out there. So, we all FaceTime. It's unrelated to healthcare at all. So it doesn't give you exactly what you need when you're seeing a patient. Okay, let's go into more specific. So depending on your role, we can get more granular with this. What are the exact pain points for providers when implementing telehealth? So regardless of your specialty, there's a couple different pain points that we often see or with adoption mistakes. When you ignore other factors of the patient engagement journey that have to happen, like the seamless appointment reminders, like a very clear link, no downloads, messaging, whatever it is, if you're missing that, what we find is patients will not choose to go to you and they'll go somewhere else. So that's actually lost revenue that providers don't even realize that they're experiencing. The second big issue, and I'm sure you can all relate if you've done telehealth, is providers end up being technical support. And I'm not sure about you. I'm pretty sure you didn't go to medical school for anything IT related. So what ends up happening is the patient has connection issues. They don't know if they're in the right place. They call the office. The provider has to waste their time figuring out, okay, click this button. Now, are you here? Are you doing this? And that's not reimbursable, right? That's just out of their own time. So it's wasting their time. It's not paid. It's taking away from your revenue at the end of the day. And in addition, there's a lot of manual work that comes in line. So kind of along the same lines, there's a lot of patient training, right? Whether it's you or somebody else, you have to walk the patient through exactly how to get there. There's double data entry when it doesn't speak to your EHR, right? So it's confusing to go back and forth if you don't have two monitors like I do, just staring at one, trying to figure out where everything goes. It's awful. There's a lot of wasted time in that, right? Even just minutes that can be used elsewhere, and it all adds up at the end of the day and equates to a better quality of life and more revenue. All right, even more of a problem, staff pain points. So a lot of providers don't realize telehealth often creates a huge stressor on staff members. And it's so critical, whatever you implement works for not only the provider, but the staff members as well, right? Because if the two aren't working together, it's not going to work at the end of the day. So what ends up happening is, depending on the solution, the staff member has to, kind of similar to the healthcare provider, has to waste their time figuring out, okay, how do I get paperwork that I need the patient to fill out prior to their appointment to them digitally? Because they're no longer, here in their waiting room, right? How do I do that? How do I download it? How do I print it? How do I upload it into the EHR, into the patient files? It goes into the wrong place. It's so stressful and so time consuming to do just that alone. Then in addition, there's double data entry, right? So if patients are scheduling online, then they, their EHR or their practice management calendar says something different. They're not speaking to each other. The staff members have to do duplicate work back and forth, which is awful. Like I said before, there's a lot of patient training. I've seen hospital systems even, I'll give you a great example. I was a patient very recently of a very large hospital network here in LA, and their process for telehealth, and I even interviewed some of the providers after the fact, they all hated their telehealth solution, which was not Mend, but it forced them, it was so confusing because there were downloads and it was all over the place. Prior to the appointment, a staff member of theirs, it was their entire job to call every telehealth patient, walk them through how to do it. There were 2 calls before the meeting. Then they had to email directions. And even with all of that prior to the appointment, it still was not clear. And I, as the patient, was sweating and calling them, trying to figure out where to go and what to download. So it creates a lot of pain for the staff members. And at the end of the day, if something happens, if a patient happens to get there, they end up being tech support as well. Sometimes it's a provider, sometimes it's them. Look, I don't know much about computers. I don't know how to help someone. Let someone else do that for you. And last but not least, the patients. Because like I said before, either people are thinking just about providers or just about patients. They're not thinking about both or all 3 of the patients, the staff members, and the providers. Patients have a very confusing experience, like I just explained of my experience, and that's a true story. They have to download an application prior to joining, which is frustrating. It's confusing. I, for one, when I had to download, didn't have space on my cell phone, so I had to figure that out. I didn't realize it. A big problem we see, huge problem, is once patients actually get to the waiting room, they're staring at a blank screen. And the average wait time in telehealth is actually 21 minutes, believe it or not. Because if you're a provider, you're going from room to room, you know how it goes. 21 minutes, can you imagine staring at a blank screen for that long? It's awful. You're bored. You don't know if you're in the right place, if you're having technical issues. So the patients end up navigating away and don't know how to get back, which is a big problem. And then the last but not least, they end up having technical issues, but they have no one to turn to, right? They don't know if they should talk to the practice, where else they should go. It's not live. It's just a really poor experience from end to end. All right, Nick, this is where I leave it to you.
All right, thanks, Jess. So it's time to give patients a more convenient way to access care. And as Jess just pointed out, it's time to make life a little bit easier for our healthcare providers and staff. So I recently heard this described as not brick and mortar, but click and mortar, at pointing to the increased adoption in this hybrid model. As a telehealth and patient engagement platform, Mend is automating your office workflows to support virtual care. So just a few slides ago, we addressed the most common pain points for providers and staff, and so many of those revolve around the additional manual effort to support these point-based solutions. So if we start right in the middle with EHR integrations, this allows that scheduling workflow to remain the same, whether it's an in-person appointment or a virtual appointment. Mend will automatically get those appointments from the EHR, so that way you can just continue to work out of that master schedule. And then that allows a lot of these other bullet points to be automated as well, such as telehealth appointment reminders going out, the distribution of your digital forms, and even getting those back into your Mend portal so you're not emailing back and forth manually. And then with telehealth, the unlimited sessions, the ability to get those appointment requests, maybe reduce a little bit of that call volume coming in. Live technical support was so big that Jess just pointed out, and even language interpretation. So that way you can continue to work to the top of your license with all patients that are in your practice, so no one gets left behind from technology. So what makes Mend practice different? The first line says it all. Mend is a practice's dream for virtual care. Many point solutions require a video conferencing solution, a form solution, a reminder solution that wasn't built for virtual care, maybe even an e-sign solution. And now there's manual effort to make all of these tools semi-talk to one another. So with Mend bringing these solutions together, you're reducing platform costs, as there's no longer a need to purchase and manage 3, 4, or 5 platforms. And in the past 15 months, staff and providers having to monitor all of these platforms, logging in, logging out, switching tabs, changing apps, we've heard more and more about burnout. There was a statistic that nurses are performing twice as many activities to support a telehealth appointment than an in-person appointment. So whatever you do to support your virtual appointment, they should be the same as an in-person appointment. There's necessary differences with the patient being at home, but those differences should be handled by the technology. And that includes what we're seeing here, the integration, the less than 15-second technical support response time, online scheduling options, and automating the rest of that workflow. And so now that we get into the most features for your money, you're going to be hard pressed to find a feature you're looking for that's not on this list. A new one that we haven't talked about yet is our engaging patient waiting room experience. Across the nation, across all telehealth platforms, as just said, patients are waiting on average 21 minutes for a staff or provider to join. And too often, those patients are left in an empty waiting room, or they're staring at a blank screen. Or I had a friend tell me that that provider's feed was live on the other end and they were just looking at a blank room and hearing whatever conversation might have been going on the other side. And so what Mend has done is we've now created this Netflix or YouTube like experience that gives the patient access to educational and informative healthcare videos. So they're now entertained while they are waiting until that staff member is ready to come and check them in, or a provider is ready to come and actually start the appointment. And once you get into the appointment, you can see here from the bullet points, we have everything that you're going to be hoping to do, from file sharing, if you need to maybe share the medical records over, or if you need the patient to share an additional file back, chat, and picture in picture is such a probably underthought of feature, but it makes a provider's life so much easier when you can just simply float that video right over your EHR, be taking notes in there and not having to switch back and forth from tabs or from one application to another. It makes life that much better during the visit. So let's take a look at what this actually is like for the patient. All the patient's going to have to do is click on a link from an email or text, enter in their date of birth, and that's going to give them access to this digital form that was automatically sent out based on the appointment type. Keyword automatically. This example here is just an intake form where maybe Mend is getting some demographics, a picture of the front and back of their insurance card, maybe a picture of their ID, but this can also run through histories. Maybe you want to capture some payment information. And to do this, the patient didn't have to have an account. They didn't have to remember a username, password, or even download an app. All they're doing is clicking a link, entering in their date of birth, and now they're in. We've talked about the technical support a lot for video visits, but you'll notice in the top right of the cell phone, there still is a need help button. One of the great things about Mend's live technical support, yes, we provide it to patients, staff, and providers, but it's available at any time when you're using Mend. So even during this digital form, if a patient did have a question, they could access it here as well. All right, now a very similar workflow for getting access to a video visit. You're clicking a link, you're entering your date of birth, and you're in. No apps, no downloads, usernames, passwords, just that link and date of birth, the patient's in. And now you're seeing the rest of that functionality you would hope to see within a video visit. There's in-visit chat. Here, we're about to see some screen share and canvas mode. You can draw on a file if you're sharing it as well. So here we can look at an X-ray, drawing a smiley face. And in the top right, there is that need help button. But the great thing about using a platform that has virtual care reminders is the ability to test ahead of time. So it might be 2 days before my visit, but I click on a link to test and I can use Mend's live technical support days before staff or a provider would ever even know that maybe my webcam wouldn't turn on. So what do these differences actually look like financially for your practice? On the left, we're looking at what those manual processes are. Things like inputting appointments into two platforms, having to manually send forms over via email, get them back, upload them to the EHR, as Jess mentioned, calling patients ahead of time to make sure, do you have the link to your appointment? Do you already have the app on your phone? Do you remember the password to get into that app? All of that takes time, and it takes time over several days leading up to the visit. So here we've totaled that out to 13 minutes. Honestly, I think that's a little bit conservative. And then if we move over to the right, what does all of this look like in Mend? Well, it starts out with putting the appointment in the EHR, and the rest gets automated. The reminders are going out. The digital forms are automatically sent out. The patient can use Mend's technical support at any time leading up to the visit, taking that off of your team. And then the provider can go in and connect when they're ready. And so maybe that still takes you a minute or two to get that first appointment into the EHR. And that's a difference of 11 minutes per visit. So let's take a look at what 11 minutes per visit can look like for a practice. In this sample, this is drawn up for maybe 6 providers, a practice that maybe they're doing about 20 visits a day, 22 working days in a month, 440 visits per month, a total time savings of 4,840 minutes. So if we take that amount of time in a month and we look at what the typical rate of pay is, and then you include all of their benefits, it gets pretty close to maybe $20 per hour. That cost savings is $1,595 per month. So take that out over the course of the year, and you're getting pretty close to $20,000. Now, for those that did attend today, we do have a special offer for those that sign up in the next 30 days and the first 50 sign up. So not only are you going to get access to the Mend Practice platform that we've talked about today, but you'll get your choice of either a free add-on or a discount on your annual plan. If you select an add-on, you can pick from the payment portal, 2 pages of custom pages for forms, secure messaging, scheduling and forms for those in-person appointments, or patient surveys. Or the other option is if you select a discount, you can get $500 off of your 1 to 5 practice plan, or $750 off a 6 to 10 provider practice plan. But what are those discounts coming off of? Here is the pricing for Mend Practice on the annual plan. 1 to 5 providers in your practice, it is $3,500, and for 6 to 10 providers, it is $5,500. So that'll bring you down to either $3,000 or $4,750. And as we get closer to it, if you are interested in the Q&A, let us know, and our team will reach out to you so we can get in touch. One more slide here. Let's take a look at how Mend actually has transformed a real practice. Empower is a behavioral health organization in Florida. When they approached Mend, they had no-shows that were literally at 50% or even higher. They had provider shortages. And then when they came to Mend, as we were their third telehealth partner, they were quickly able to adapt to serving everyone statewide. Now they can reach the entire state of Florida. Just adding virtual care, making it more convenient for the patient to be at home, almost got their no-show rate down into the single digits. And they've been entirely virtual for pretty much several years now. And so when the pandemic did hit, they were well prepared. They've even had a wait list of psychiatrists that want to be a part of the practice, because even the providers can be at home. You don't actually have to go into the office, just like so many of us have worked from home over the past 15 months. And in reducing the amount of rent and overhead, they've saved greater than $150,000 in that first 6 months of transitioning to pretty much a fully virtual practice. All right, does anyone have any questions? Thank you. Let's see what we have. All right, Jess, I will let you take the first one. Where do you think telehealth reimbursement is going?
It's really interesting. I think politically over the last couple months, it was interesting to see what happened with how everything shook out. I think telehealth reimbursements are 100% here to stay. So the government has recognized that telehealth is a more efficient way of delivering healthcare. to patients. They're dealing more and more. There's obviously a shortage in healthcare with healthcare providers. And so this opens up a whole new door of how do we see more patients more often. So this isn't going anywhere. It was a matter of time, and we're officially here. So what you see is what you get.
Totally. It's great to see all the private payers get behind it in more states. And even right now, we're in the middle of another just FCC funding round. So more and more
Yeah.
practices can continue to use telehealth. It's great. All right, let's see. All right, so what do you suggest practices do to ensure all patients are comfortable with virtual care?
Oh, all for me. I think both of us should take this
We'll
one.
take the, all right.
All right, I'll talk more from the patient side and what I would like to see when I go for telehealth appointments. And then Nick, please speak to what you've seen in practice that's really helped. So from the patient side, I think giving clear instructions is always helpful. However, I am a very strong believer that I'll let you in on a little secret. I don't read any instructions, and it may be to my detriment, right? So this is unrelated to telehealth. It's just in general. So something has to be very, very intuitive for the patient. So you need to adopt a solution where it's like telehealth for dummies almost. It's so easy for a patient to click through and get to the appointment itself. Technology is a lot more challenging for people than you would think. So you want to make their lives that much easier where you can. So I think really, really looking at whatever solution you have and from the patient's perspective and figuring out, is this easy for my patient to get into the visit with me? That's critical.
Love it. And from the practice point of view, I think you hit on a couple key points from what a patient would expect. I've seen a big difference in practices with some more so and not so successful programs is the communication that they provide with what to expect in virtual care. A lot of patients, they went through telehealth for maybe their first or second time throughout the pandemic, and they weren't totally sure what to expect. And so it left patients like Jess at the last minute wondering, where do I need to go to download this? What do I need to do to have prepared? And it's a big reason that maybe it is, something in the marketing materials on your site, or it's in the communication that you push out via, email, text, and phone calls to patients, especially if you're trying to reach all different demographics of patients. Making sure that there's a communication that can reach landlines is still important today. And then when we talk about, some of the cities and reaching patients that English is not their first language, and that's what your providers are, it's super important to be able to bring in interpreters. And having a platform that maybe is interpretation service agnostic, where you can just dial out to whatever your preferred interpretation service is, get that interpreter's audio or maybe even video directly into the visit, will of course help make both sides that much more comfortable. All right, and we had a question come in. Does Mend have analytics in the platform? We certainly do. Mend has pretty much full reporting on anything that you would expect and any of the interactions that are taking place between the practice and the patient. With telehealth, of course, reporting on visits is going to be critically important, maybe in case you ever get audited for, did these telehealth visits actually happen? Mend has all of that. So you can go back and prove this provider, this patient talked on this day for this amount of time. And then the reporting on digital forms, the quality of these video visits. Jess, am I missing anything here?
No, I think that's perfect. Yeah, it's really shocking to me. I probably have turned to Nick a number of times and said, "Why would a doctor want all of this data?" And it's shocking to see what you would need at different times, and really understanding that, and to know that whatever your need is, it is covered.
All right, a couple other questions. Let's see. Can someone use their own digital forms within Mend? You certainly can. Mend does have a library of available, ready to go intake form templates, ready to go clinical assessments that we have dozens of them. But if you do have forms that you would like us to use, we can create those for you. There is a small one-time fee. And if they're copyrighted, we just need you to get permission that we can recreate those. All right. Oh, why have you seen telehealth maybe fail for a practice? Jess, have anything here?
Yeah, a lot. From a lot of different perspectives, the provider perspective, the staff perspective, and the patient perspective. Focusing on the provider and the staff perspective, I've seen it fail because they didn't factor in the little nuances when it comes to telehealth. A lot of the problem on the healthcare side is they just look at telehealth as, that face-to-face video visit, and they don't factor in all the other aspects of the virtual care journey, because it's exactly the same as your physical practice. And we all know, we're pretty used to by now, you deal with appointment reminders, you call the patient, you have them join the visit, the staff member, maybe a nurse or someone else, comes in prior to the provider. There's an established process, and a lot of providers and staff members don't realize the same is true for telehealth. So it's really critical to figure that side out. And then on the patient side, not having those patient engagement aspects leads to such confusion and chaos for the patient that they oftentimes abandon it entirely. I was talking to someone the other day that we're talking about our enhanced virtual waiting room and solving the problem of patients not being engaged while they wait. She was recently on a visit with her husband where they waited in the virtual waiting room. It was a blank virtual waiting room for an hour and a half, right? And she was screaming at her husband, like, we have to leave, the doctor's never showing up. So I think from the patient perspective, I've seen it fail miserably. And I've actually been guilty of getting up and leaving when I don't think the doctor's coming, when I'm just staring at a blank screen. So it's critical to have something there for them to tell them you're in the right place, don't leave, and here's something entertaining while you wait. And we've solved that.
Yeah, those are fantastic. I mean, first impressions are critical with patients adopting to virtual care. And something that you see more and more is advertising for virtual care and health systems wanting you to, go use their platform instead of another. And when patients have that option, they can see any provider in their state really at this point. It is everything that Jess touched on to make sure that it is a complete experience for both sides to know what they're going to expect. All right. Thank you, everybody. That is all for today. We will send out the video of the webinar and FAQ with all the questions that we did not have time to answer.
Thank you, everyone.